Good afternoon, friends. You're listening to EBC Radio 1170 AM Aapki Choice, and I am your host Alka. A very warm welcome on EBC Radio. All my beautiful listeners who are listening to us in New York, New Jersey, and Pennsylvania. And today, this is a health education series. And today we have a very, very special guest. And before that, I would like to give a big thanks to RWJBarnabas Health for sponsoring this segment. And we are going to be speaking to Shisha Patel. She's a senior coordinator, Indian Medical Program at Robert Wood Johnson University Hospital, Somerset at Robert Wood Johnson Barnabas Health Facility. So Shisha is a Gujarat native. Shisha speaks Gujarati, Hindi fluently. She obtained a bachelor's degree in pre-professional biology from Keene University and a master's degree in public health from Cumberland University. She previously served as a healthy educator for the Indian community with the hospital's community health department. So with that, a very warm welcome, Shisha, on EBC Radio. How are you doing?
Hi, Alkaji and EBC listeners. Thank you for having me today. I'm great.
Fantastic. And I'm so privileged and honored that I know you before. We worked in few organizations here and there for some time. And today I'm speaking to you on the radio.
Yes.
So that's fantastic. So Shisha, as I just read a little bit about you, that you're serving our Indian community in the medical programs at Robert Wood Johnson Barnabas Health. So can you tell us what are some of the most common health issues that are prevalent among the Indian community?
Yes, so some of the leading common health issues that we see on everyday basis within our Asian Indian community is with the leading, number one is cancer. Behind cancer we see a lot of heart patients, stroke patients, and diabetes. These four have to be the top leading health issues that we have been dealing with.
Well, and all of them are very, very serious, and I would say they all, in a way, they are very slow killer, right?
Yes, that's right.
Yeah, so now studies have shown that members of the Asian Indian community are less likely than other groups to get regular health screenings, but why?
So regular health screenings are challenging within our community because there's many different barriers. Some of the barriers are language, our culture, health literacy, health insurance, and immigration status. So in my role, I'm here to help and navigate through these barriers and improve health outcome of our community.
Oh, that's fantastic. And you being Indian, helping Indian community, that's such a comfort to the patients and whoever comes there. I think our community should come out and seek help at Robert Wood Johnson Barnabas Health. And Shisha Patel, she is there to help our Indian community, and she is doing a special program for Indian community, right?
Absolutely. I'm here to help anytime anybody has any questions or needs any kind of medical assistance. We're here to help you.
So tell us about some of the health screenings and outreach activities you do to make members of the Indian community more aware of what they can do to take care of their health.
Yes, so there are several different ways we outreach in the community. We provide health education, health screenings. We also do health fair. Our top health fair that is very popular. We do that in partnership with the Health Camp of New Jersey. We have one coming up soon. On July 14th, we have a health camp. It's at Balaji Temple in Bridgewater. And at this camp, we will be providing free blood pressure screenings and glucose screenings. We also have some educational opportunities about different service lines, such as physical therapy, dietitians. We are going to have available occupational therapists and many more. We also provide meet the doctor station, so we have doctors from different specialty who will be screening patients for different things and answering questions about health and wellness.
And that is absolutely free.
Yes, that's correct.
So friends, if you do not have insurance, or even if your insurance doesn't cover all what you are there for and you have to pay out of your pocket, this is the best time for you to go for all these screenings over there, and it will be done free, and you can just be part of that health camp and take that advantage over there. So how does the Indian medical program help make it easier for members of the Indian community to get the care that they need?
So Indian medical program is designed to make healthcare easily accessible to the community. Mm-hmm. We're here to bridge the gaps and eliminate the health disparities and improve health outcomes of our Asian Indian community.
That is fantastic, Shisha. I'm so happy to hear all the services what you're providing through the hospital, and as your role, it's so helpful to South Asian community living in New Jersey especially, right? So tell us more about yourself and what is your role?
Sure. In my role, I assist patients with finding providers that are covered within their insurance plans. I help patients schedule appointments, fill out forms, accompany patients to their appointments to help them understand treatment plans in their preferred language. I also follow through the treatment plan with the patient and provide transportations for qualified patients. Mm-hmm. As you had mentioned earlier, I speak both Hindi and Gujarati, mm-hmm. so I'm able to help with interpretation and translation as well.
So these patients, you help them, are they have to be insured, or anybody can be part of that?
Anybody can be part of my program. There's different resources available in the community, mm-hmm. so I'm here to help connect patients to resources that are available.
Okay. So that is good to know. And friends, again, if you're listening and you are somebody who is avoiding taking care of yourself related to health, so please reach out to Shisha. Shisha, how can they reach you if they have to?
Absolutely. So my cell phone number is 908-642-3739. Patients can reach out to me easily. I'm usually at work between 8 and 4, Monday through Friday.
Fantastic. So how do patients access the Indian medical programs? Is there a charge?
There is no charge. It's a free program, which is a great thing for the community. I'm here to help. Really, this is a community service work that we're doing here, and I think everybody should take advantage of this. And once again, I'd like to repeat my number, 908-642-3739. That's my cell phone number. Anybody can call me and connect with me.
Fantastic. So now what do you say to members of the Indian community who are hesitant about coming to the hospital or seeing a doctor, which is, I think, it's very, very common. We all know that going to the doctor is going to help you. Annual checkups are one of the most important things, especially after age 40 or so, because I speak to so many doctors and they all say that annual checkup you must do. So, can you talk about it a little bit?
Yes, I would say, just give me a call. I'm here to help and make, this hospital visit stress and hassle-free. I'm here to guide everybody through every step of the way. And if I'm not able to help, I have resources available in the community that can help patients. So please, anyone that needs any assistance, do not hesitate. I'm here to help with any questions or any navigations that is needed within the healthcare.
Yes, and friends, everybody, sometimes when you are just diagnosed with diabetes or high blood pressure or cancer is of course a very serious matter, and you don't take it very seriously like blood pressure or diabetes, but it is very, very serious disease, and you must get it treated immediately. If you do it faster, you can be out of it, and it can be. It can be controlled, and don't think that you have it now, you have to live with it. Yes, even if you have to live with it, you can really have a quality life than creating more diseases. So Shisha is here to help at RWJBarnabas Health and Somerset. So reach out to her if you want, or even if you can visit to the Robert Wood Johnson website. She can also be found over there as well, right, Shisha?
Absolutely.
Yeah. So that is amazing. And just knowing your own person is there to help you, what else you want. Sometimes you feel helpless. I don't know who's going to guide me. I don't know this language. English I don't speak. But here she can speak Hindi and Gujarati. So please seek for Shisha Patel at RWJBarnabas Health. Once again, I would like to thank RWJBarnabas Health for sponsoring this health education series on EBC Radio. So Shisha, without naming names, I know you have helped so many people. So can you share an example of a recent patient who you helped through the Indian medical program?
Absolutely. So I'll talk about a patient I was helping today. This particular patient had been putting off doing their annual mammogram for quite some while. In fact, they were having some pain, but they just didn't want to bother their working professional children, and they also didn't have any family history. So, they thought it was okay to put off doing their annual mammogram screening. But as the pain was progressing, they were talking to one of their neighbors, and they somehow found out about my program and reached out to me. So I was able to get them help that they needed. We scheduled their appointments. I was able to bring them in for an appointment. Unfortunately, after the mammogram, we found out that they were diagnosed with stage 2 breast cancer.
Oh my God.
And, if this patient had delayed it any further, it would have been something different. So, that's why I request all the listeners to please just don't delay getting care. Just follow all the age-appropriate annual screenings because, prevention is always better than the cure. So, as I mentioned earlier, please call us. We're here for you to help you, and don't hesitate to reach out to us.
Yes, and you rightly said that prevention is so important. Early detection is also equally very, very important than you reaching to later stages where treatment cannot be done. So early the detection is happening, the cure can be done easily.
Absolutely.
With all the technology, with all the expertise of our great doctors in the hospitals, so much of help is available. It's just a matter of reaching on time, and please, ignorance is not acceptable right now. It's your health. Health is wealth, right?
Yes, that's correct.
Yeah, so please, friends, seek help at RWJBarnabas Health, and Shisha Patel is there to speak Hindi, English, and Gujarati. And she can definitely guide you into a right direction. And there are so many resources they have where insured or uninsured programs are, all kind of facilities there, and they can guide you. If you cannot support the cost or whatever, there are other programs. Like she just mentioned, there is a health camp happening at Balaji Temple. So there also they would be able to screen you in several different things like diabetes or blood pressure, or they have different doctors from all over, right?
Yes, that's correct.
Yeah, so please reach out to, and once again, thanks to RWJBarnabas Health for supporting this health education series. And Shisha, any last words you want to tell our listeners?
No, just wanted to remind our listeners, my phone number once again, 908-642-3739.
Thank you. Thank you so much for coming on airwaves of EBC Radio and sharing all this valuable information with our listeners, and hoping they will take this advantage and reach out to you.
Thank you, Akaji and EBC Radio.
Thank you.